În primul rând am să vă transmit la toți salutări din Ann Arbor, Michigan.
First
Și
of all, I would like to greet
foarte mult
you
să fiu
all
împreună
from
cu
Ann Arbor,
Um,
Michigan. I'm glad
I
to
would like to switch
be
now to
here
English
with you.
just to keep on time. And I would like to, of course, thank the Society of Diabetic Neuropathy, Professor Radulian and Dr. Norina Gavan for organizing this very important educational event to train the next generations of Romanian specialists. Today, I will cover with you a little bit of a less used, I would say, topic for the summer school of diabetic neuropathy and and diabetic foot, which relates to the post-acute sequelae of the COVID-19 and the impact of neurologic complication in diabetes, because for the last 16 or 17 months, our life has definitely been affected by this pandemic. And with that said, during this presentation, I'm just going to briefly define what are the post-acute sequelae of the COVID-19 or PASC, discuss some of the data that shows evidence on the intersection between PASC and diabetes, unveil some of the recent findings regarding the mechanism of pathophysiology of PASC, and then end by reviewing what we've learned, particularly with respect to the neurologic complications of PASC and impact on diabetes and diabetic neuropathies. So what is PASC? And this term actually has additional synonym. Many people call it long COVID. But it is a constellation of symptoms and signs that involve, a broad spectrum from the head to the toes, with brain ischemia, cognitive impairment, various forms of peripheral and autonomic neuropathy that are induced by changes in the serotonin production and other neuronal transmission mechanisms, mood disorders, as well as changes in the long-term lung and cardiac capacity, kidney damage, circulatory hypertension, increased risk of thrombosis, and vascular and organ fibrosis. Respect with diabetes, direct effect on pancreas and pancreatic damage, which is now emerging as a potential reason of the increased incidence of diabetes post-COVID, muscle fatigue, weakness, and COVID toes. And before we go to reflect on the mechanism and diabetes, I decided that it would be nice to just present an overview of the timeline, and starting with February or March of 2020, when the most important actions, particularly for us in the medical community, were to try to prevent the transmission with measures such as mask and protection equipment and social distancing. And then we have witnessed initially milder form of disease, but then more moderate and severe, leading to hospitalizations. We have made a huge progress in understanding how to treat acute disease and what are the strategies that are most effective. And then, of course, unfortunately, witnessed quite a large number of people who had, in fact, suffered severe disease, including death. And during this timeline, particularly last fall, it emerged that up to 20% of those who had COVID started to develop this bizarre condition called now post-COVID or PASC, post-acute sequelae, and experience the plethora of symptoms and signs that I presented in the first slide. Originally, we were under the impression that only people who had severe COVID that required hospitalization will develop this PASC or long COVID. However, a very recent research that has been published in JAMA a couple of months ago demonstrate, as seen in here, that in fact the risk of developing this long COVID is similar among those who have experience severe or even mild disease. And this graph here demonstrates exactly these findings. In addition, to our surprise, is that even young people, and actually quite young people, can develop PASC and have lingering symptoms and signs that affect their entire capability or engaging in either educational or job-related activities for now up to 8 and 9 months. So let's review a little bit of data regarding COVID and diabetes and the long COVID and diabetes. Again, to reflect on the timeline, over the last year or so, it became apparent that among people with diabetes, the prevalence of those who have developed severe disease had been much higher, and that had been true across the entire world, from China to Europe, United States, or South America. Here, particularly in the United States, last summer, it became apparent that diabetes was one of the 3 most comorbid conditions that required ICU admission or developing acute renal injury. And in multiple cohorts, also the presence of diabetes, particularly on those people who presented with high blood glucose at admission, doubled the 7 and 28 days mortality rates across the entire nation here in US, and doubled the risk of acute kidney injury. So these are some of the references. Actually, I think that just a couple of weeks ago, it became apparent that, in fact,
Rezultat?
I'm sorry, I hear some interference. I'm not sure what's happening. Maybe the technical people can address this. All right, so here is data that has been just recently published from the large Scottish cohort, who have evaluated basically the average deaths per week, comparing 4 years prior to the COVID pandemic, which is shown here in the red line, and then that's in the same week, starting with January 2020, and in the blue line are the non-COVID deaths, and then in the gray shaded areas are the COVID deaths. And it's the data it's telling by itself. You can see how much the deaths related to COVID have increased, starting as of March of 2020, and then with a lingering effect even until very recent weeks, June 2021. And here on the right, out of these 5,400,000 Scottish, this is the population of Scotland, they also have a very, very close follow-up of those with diabetes. And as you can see here, the deaths in patients with diabetes, both in men and in females, were significantly higher than compared with people who get COVID and didn't have diabetes. So why is long COVID also, and COVID in general, so much worse in patients with diabetes? And here are some of the reasons. Definitely diabetes predisposes to all these chronic complications that all have been demonstrated to increase the risk of COVID by itself, starting with microvascular complications, which are the kidney injury, the peripheral and autonomic neuropathies, the diabetic foot complications that you've heard a lot already. And here at Michigan, we have also been at the forefront of understanding what's happening in the COVID toes and COVID foot, eye disease, and then of course the cardiovascular complications with coronary heart disease, heart failure, that it's emerging as the leading cardiovascular complication in diabetes, unfortunately. And then, as I mentioned earlier, now, after we have more than 1 year data, we have been able to demonstrate that, in fact, the incidence of diabetes has increased substantially in the last year, and definitely due to an intersection between the acute inflammatory and immune injury that is unveiled at pancreatic levels due to COVID infection. Here is another pretty hot off the press data in a very large cohort of patients that are being seen in our Veteran Health Administration. The Veteran Health or the VA administration had unique electronic medical records for the entire country. So it is really a very important resource to study and understand outcomes. And as you can see here, the type of complications, organ-specific complications, have been calculated using this type of Z-score weighted analysis, with the red colors demonstrating higher excess burden amongst these various complications. As you can see here, circulatory and cognitive and endocrine. And then looking by people with diabetes, those are significantly higher among patients with diabetes. And again, this is a cohort that studied the entire United States veteran health population. Definitely those are predominantly male, but the data is quite compelling. So this is another large study that was published earlier in Diabetic Medicine, also concentrating on patient-reported outcome. As we already well know, is that everything we do, all the research that we are doing, is to be able to apply it in the most meaningful way for patients, and thus understanding what patients feel when we apply a certain treatment or when they face a disease, it's very important. And this is a study that evaluated patient-reported outcomes in more than 2,500 patients patients with diabetes, with a large proportion of female gender as well, so approximately 45% were women, and understood out of the data that socioeconomic distress is quite important. The post-traumatic stress as well, and psychological adaptive difficulties that have emerged past of this pandemic, particularly in women and in those who had prior complications, including neurological complications. So what are the potential mechanisms? And the data is emerging as we speak, but in diabetes and in general in COVID, there are very interesting interrelated mechanisms that are triggered by these acute inflammatory and autoimmune pathways that are triggered through the COVID infection, that then underline additional metabolic dysfunction and this microvascular direct effect, this microvascular damage called endothelitis. And all of this are particularly higher in diabetes because, as you very well know, chronic inflammation, metabolic dysfunction, and microvascular dysfunction are the hallmark of the mechanism that promote both microvascular and as well as macrovascular complications. And this is what endothelitis mean. Here are healthy vascular bed with these endothelial cells and normal diameters of the microvasculature promoting oxygenated blood flow through all these organs, including the brain, the peripheral, the autonomic nervous system, the kidneys, the eyes, and so on. And then through this acute inflammatory and immune injury that then promotes apoptosis and thrombosis, and then leading to these low oxygenations on the bed of inflammation, then obstruct the capillary bed and then leads to the endothelitis. And recent data had demonstrated that this changes are pretty significant, particularly also in the brain, and all these microvasculatures that involves the peripheral autonomic nervous system and the kidney, for instance. So having said that, let's move on and discuss some of the neurological complications in long COVID. We know that the acute infection can promote acute complication as well, such as stroke, brain inflammation, delirium, dementia, as well as loss of smell and taste. With the peripheral, particularly the peripheral nervous system invasion, patient may experience peripheral nerve damage, damage to the heart regulation through the autonomic innervation of the heart, muscle injury, and fatigue. And then this would emerge and progress towards fatigue, generalized weakness, postural hypotension, brain fog, poor memory, headaches, poor sleep, inability to perform activity of daily living, and depression. Very recent data, again, also emerging from our colleagues in Scotland, has also looked at the risk of fatal or critical care unit treated COVID-19 in people with long COVID. And as you can see here, although many of the risk factors that were expected to contribute to worse outcomes, such as DKA, hypoglycemia, heart disease, asthma, or chronic lower airway disease, as you can see here, in fact, prior neurological complications, and not epilepsy, but either peripheral or central nervous system complications, were in fact associated with the highest risk for developing these complications. Here is data from another very large cohort. This is an international cohort that enrolled more than 3,700 patients in more than 56 countries. Of course, as you can see here, they were pretty well distributed across the age range from 30 to 60s and higher. There were indeed predominantly female, those who responded. And as you can see here, not all of these people were hospitalized. In fact, majority of these people were not hospitalized, which further sustain what I mentioned earlier, that people who have had mild disease may develop these long COVID complications, and have been basically queried to see how many had symptoms for more than 90 days. And I think that that's something else that it is important to mention, is that in general, long COVID, it is accepted now to be relevant for those patients who have had these symptoms and signs for at least 90 days or more after the acute infection. And as you can see here, among this large cohort, the majority of these post-COVID long-term symptoms were dominated by fatigue, this post-exertional malaise, and then 55% with this cognitive dysfunction. And these symptoms and signs are really very difficult to treat. They are, of course, non-specific, but they are making patients' lives very difficult to perform their activities and then go on with their life. Here is additional data from this cohort. As you can see here on the left, the risk of developing this long-term COVID seems to be pretty equal. Females are shown here in blue and male in orange. And then based on the age here on the right, you can see that it appears that in fact the risk of developing these symptoms and signs is higher in the younger people that are shown in the dark blue and dark green compared with those who are above 60 and 70. So then again, these are things that appear to affect predominantly younger population. And the type of cognitive dysfunction, either all combined or attention seeking, executive functioning, problem solving, confusion, and agnosia are pretty high. And then again, it's very interesting observations to see that younger people who have COVID are not at all protected to develop these longer term consequences. And in fact, looking at our most recent data here in the US, particularly since we see now again a surge among those people who are not vaccinated, unfortunately, most severe cases now are among younger people. Additional data that actually enroll much more even by gender population, 48% female, 52% male, emerge now from Wuhan, China. As you know, they have been the initial place where this virus hit. So then they do have now more than a year follow-up, and as you can see here, among these patients who had COVID at the beginning of the pandemic, all of these people have been among those who had first COVID. About 4% were admitted in the ICU. All of them had confirmed COVID by laboratory testing, PCR testing. And as I mentioned earlier, even in China, 3%, so increase in the incidence of diabetes by 3%. And then again, the same type of symptoms, 63% dominated by fatigue, muscle weakness, brain fog, and anxiety and depression, and serious sleep difficulties. These are just some of the studies, and more are emerging as we speak. And so in a summary of the type of neurological complications that we see most right now as part of this long COVID, loss of smell and taste in some of these patients that we believed that are just associated with the acute disease. In fact, they seem to linger for months. And again, the same type of cognitive dysfunction, autonomic dysfunction with dizziness, peripheral neuropathy dysfunction with loss of larger fiber and mild balance issues, and then the memory, the speech, anxiety, and depression. So before I end, I just wanted to show you some of the data here in Michigan. And this is actually very interesting because here we start in March of 2020. Since then, we had approximately 896,000 cases, and unfortunately almost 20,000 deaths. But this is, so you can see by week how we fared with this first wave of infection last year that we thought was pretty bad. But as you can see here in the fall of 2020, we had another large wave, and then we just emerged from the third wave in March and April of 2021. As we speak here in Michigan, we are at 62.5 vaccination coverage, which is actually pretty good, still not at the goal, but we are a state that achieved more than 60% vaccination among those who are eligible, which is adults 16 and above, and we started now quite intensely to vaccinate kids 12 years and older. And here is some data that we just finished analyzing in our hospital cohort. In our hospital, we had about more than 1,000. Actually, we had about 1,500 people, but this data analyzes the first 1,000 patients, and we had event-free survival about 789. And you can see here the difference in age. Of course, elderly people, male, more likely to die. And then smokers, but also diabetes, definitely one of the strongest risk factors of death in our hospital, particularly if they presented with hyperglycemia at admission. And then, of course, as expected, hypertension, coronary artery disease, and end-stage renal disease. Because of the number of cases that we have seen of developing this sequelae, and because our primary care physicians were completely overwhelmed, we actually opened a multidisciplinary post-COVID clinic to care for all these patients. And actually this is also a cutting edge clinic because everybody is also enrolled in research. So this is 100% research integrated into the clinical care. We have a model in which initial evaluation is done in person, and we have a team of endocrinologists, physical medicine and rehabilitations, neuropsychologists and podiatrists that evaluate this patient at the first intake and then referred as needed to these various subspecialties depending on the finding. And this is basically the clinic flow. It's been a very interesting experience. Of course, we do have also conferences in which review all these most interesting cases, and we do not address just diabetes. I mean, there are many other endocrine conditions, particularly obesity, but also adrenal, that appear to be involved in the, in the risk of developing this sequelae of COVID. And our clinic opened officially on April 30th. It has been quite highly mediatized in the press and on TV. As we speak, and although we have very clear criteria in which we limit, those patients who can be seen, for those who have 100% confirmed COVID by lab, we still have now, with more than 280 people that are waiting to be seen. We have received initially more than 600, but after screening for those with confirmed COVID. And I wanted to also show you very recent data that we started to analyze and just submitted for publication. And as you can see here, we looked at neurological and mental health complications among those with post-COVID, as you can see here, among those with diabetes, they are pretty high, and it's true both for type 1 and type 2 diabetes, although type 2 diabetes appears to be a little bit more prevalent in younger ages. Once they reach 40 and higher, the risks are pretty similar. And here also we looked at potential mechanism, and we understand here that having prior microvascular complication appears to be one of, like kidney and eye complication, as well as heart disease, also promote this brain dysfunction, as well as autonomic and peripheral neuropathy, typical sequelae of COVID in this patient population. However, this data hasn't been published yet, and we continue to analyze. So before I end, I just want to say that this is a very serious condition. I think that it is our duty as physicians to educate the entire population on the science and the truth behind the vaccine. For those of you who may not be aware, I just want to highlight that this vaccine had been in the work for more than 20 years. The technology had been really in the work for more than 20 years. It is been highly researched, and we were really lucky that we were at that stage to be able to start giving the vaccine in humans when the pandemic struck. The more we vaccinate, the more likely it will be to get back to our life like it used to be. And we don't have really too much time, because these new variants are, as you very well hear everywhere in the news, much more contagious and much more severe. As I said earlier, here in Michigan, we see that younger people, and particularly children who don't have yet that chance to get a vaccine, are at risk. So thus, to protect our children, it is our duty to educate people to get the vaccine. And with that, I like to also highlight the large team of colleagues working at the forefront, including our very active podiatry clinic. We are so happy now. We have just hired 2 more podiatrists here at Michigan, and of course are part of the Diabetic Foot Consortium, running several new protocols to understand how to better prevent these diabetic foot ulcers with a personalized approach. And with that, I would also like to highlight my first mentor, Professor Gheorghe Băcanu, and here is the University of Timișoara Medical School and Timișoara downtown that looks actually very beautiful. Thank you so much.